My direct connection with IVF, obviously I haven't worked in that field. My brother is an IVF specialist, so I've been pretty much closely following his input into IVF. So that's my knowledge of IVF. But I have worked with all specialities, medicine, surgery, gynae, in my capacity as a psychiatrist in my career.
All right, sir. So, what is your feedback about the entire Genesis conference which is happening here?
I don't know about the feedback from others. The point that strikes you the most,
Yes.
that this is one event which is not around infertility only.
Correct.
So I actually find it very interesting. So for example, there was a lecture going on about thyroid, there's a lecture on psychology, there's a lecture on psychiatry. Topics that would ordinarily not be covered in an IVF. So it is not an
An
exclusive...
IVF-centric conference.
Yeah, so it is not an exclusive IVF-centric conference, which I think is very interesting and I'm sure very interesting for the participants.
All right, sir. So now we get a little topic specific. How can a psychiatrist help in infertility management?
I would obviously elaborate more on this during the talk. 2 or 3 things. In fact, when I sat down to choose the topic, the first feedback I had was, it might be best to talk about how a psychiatrist would help the doctor, the IVF specialist, rather than the patient. Yes, we will look at the patient becoming anxious and depressed and having psychological problems, but also talking about the doctor who might feel that he is not as successful as he should be. So I'll be covering both of these things.
All right, sir. So how important is a patient's emotional well-being in IVF treatment?
Extremely, extremely. You see, the first thing to note is that this is actually not a patient. This patient is not having a symptom, not an illness compared to other patients.
Correct.
This is a person who's been unable to have a child.
Correct.
So emotionally, this person is very distressed. So yes, they'll be very, very distressed.
Yeah. So can you elaborate on the collective care approach?
That's what we do when we liaise with other specialities. See, for example, we do not have a direct contribution into, say, IVF.
IVF, correct.
But if we work collaboratively with the IVF specialist, whether it is to take care of the patient who is emotionally stressed, or the patient has done his IVF and failed and is considering, should I go for re-challenge, or the patient is having financial problems, or the patient is having cultural problems, the mother-in-law pushing that you must have a child.
Correct.
So that is where we come in to help indirectly, and we look after. I am still of the opinion we must collaboratively work with the doctor to look after him or her as well. So that's where we will work together with them.
So what is your take-home message from this entire event?
2 messages. One, the IVF specialist still remains the most important person for the patient, even from psychological point of view.
Perfect.
The support that has to be given to the patient needs to come primarily from the specialist himself, unless it's an extreme case. And the IVF specialist needs to make sure that he or she is looking after himself equally. That's my message.